Swimmer's ear is an infection in the outer ear canal which runs from your eardrum to the outside of your head. It's often brought on by water that remains in your ear, creating a moist environment, which of course aids the growth of bacteria. We've asked Dr. Paulo to come in and discuss this common infection and how to prevent it. So Paulo, swimmer's ear, we talk about an infection, but what is actually happening to cause this? What is the mechanics around it, maybe?
Right, so the technical term is otitis externa, as opposed to otitis media, which is inflammation of the eardrum, so to speak, of the medial part, which is common in children, for example. So in swimmers, when people who swim frequently, then we give it the name swimmer's ear,
right,
because it is actually more common in people that swim frequently. And that is primarily because of the fact that the outside of the ear is exposed to the water.
Okay, so it's a fairly constant moist environment basically that we're dealing with. What are the causes? What's the actual cause of it?
Okay, so this area of your ear, so the outside area as you described it, from the drum all the way out, the canal all the way out, is lined by a very thin, slightly acidic film. Okay, which is there for its antimicrobial activity. Because it's acidic, it discourages the growth of bacteria.
Right.
So earwax, for example, is made up mostly of this film, as it is renewed, of dead skin cells and any other debris that happens to be there. So potential causes include obviously swimming in waters where the bacterial count is very high, such as rivers, dams and lakes usually. It includes also having moisture in the ears. Okay, so in other words, water in the ears, which, as you say, creates a conducive environment for bacterial growth. And then, of course, also damage to the sensitive skin that lines this part of the ear. Because if you damage it, it creates a little break, and then bacteria can get in.
Right. So you talk about swimmer's ear, and you talk about swimmers in lakes and rivers and things like that. But obviously in swimming pools as well. Obviously that's chlorinated to hopefully kill most of the bacteria.
Correct.
But would that also be a risk?
It would be a risk because chlorine has been shown to dry the skin.
Okay.
So it'll dry the skin around the ear, and by drying the skin, it will also have an effect on this acidic film. So should there then be bacteria involved some other time, in this case, the chlorine would have reduced your barriers of defense.
Okay. So you're creating an ideal environment for bacteria to thrive. So what would the symptoms and signs be of swimmer's ear?
We divide it into mild, moderate, and more complicated. But in terms of mild symptoms, that would include slight pain or discomfort, especially if you pull on the ear or press from the outside. Okay, it can include a little redness, sometimes the feeling that the ear is blocked as well, sensitivity to water.
Right.
And so those are the sort of mild symptoms. If you develop fever, severe pain, for example, if the lymph nodes in the neck begin to grow in size, then it's more severe. You should see a doctor immediately.
So it's interesting. It sounds like it's a fairly benign thing and it can be helped. But you say fever and swollen lymph nodes, so it can become quite a big.
And also a discharge. So if you start having a discharge coming out of the ear, then the infection is more severe.
Right. If people are dealing with ear infections, I think they seem to be fairly common, and some of them clear easily. If you don't deal with an infection in your ear, what are the possible consequences?
All right, look, the most terrible consequence is that the infection will go into the bone close to the ear, and then of course there are very large problems. But in most cases of swimmer's ear, the infection may begin with very mild symptoms, and those will only stay there while your body deals with the infection. While your body gears up to deal with the infection, manufactures the antibodies, the soldiers that will come and fight the bacteria. In most cases, your body would be able to deal with it. In cases where your immune system is, relatively speaking, compromised, or where these infections happen very often, and at some stage the immune system is not able to sort of catch up, or you are inoculated with a higher dose, so to speak, of bacteria, or a sort of a worse type of bacteria because you went swimming somewhere else. Okay, so all of these factors can play a role in terms of the severity of the possible severity of the infection.
Okay. And generally, what are some of the risk factors that we should be watching out for to avoid this condition?
Well, of course, you should not swim in rivers, lakes, or dams where the microbial count is very high, if you have that count, or even in the sea, for example, All right, so that's the one step. If you do swim frequently, you should protect your ears with earplugs or wear a swimming cap as well. Of course, after swimming, even after showering, for example, you should make sure that there's no water sort of left in your ear. When you dry yourself, dry only the outside of the ear, and don't rub on the skin that is
excessive earbud use
in the ear canal.
Like
yes,
yeah.
And then of course not just earbud, the use of things such as hairpins, nails. So all of that can damage this film as well as the skin under the film.
Right, right.
So all of these are factors that one must consider in terms of possible prevention.
Okay. Paulo, I mean, apart from the swimming factor or the water factor, are certain people generally more prone to ear infections than others?
Yes, so obviously that would have to do with your own immune system, for example. Obviously, if your immune system is challenged in many other ways, so in other words, your immune system is fighting wars in other territories and it is stretched out, so to speak, that will make you more susceptible to an infection in the outside of the ear. The other very important factor has to do with the architecture of your ear. Right. So the shape, the size of the canal. All right, so not everybody's ears are exactly the same.
Yes.
Okay, so that can also play a role. Also, the production of this acidic film that is produced by your own body. Mm-hmm. Okay, so if that production is defective in some way or other, it means that the film is not covering the skin and therefore you have no protection, or at least you don't have the protection that you should have.
Right.
So all of these factors would obviously play a role in terms of the person itself, in terms of the territory, as I like to call it, as opposed to the environmental factors that we've already spoken about.
Okay. So Paulo, we've put Similasan Swimmer's Ear Relief into the Real Health Medicine cabinet. This is a product that's going to help sort of manage the symptoms and moderate if you do get some kind of infection in your ear. How does it actually work though?
All right, so this is from Similasan, which is a Swiss company. They've been around for over 40 years. They produce homeopathic preparations according to homeopathic principles. So what they do is they take plant substances that have been studied and known to have certain effects, and they will dilute them and then dilute the dilution and so on. And the substances in this product, so it's an all-natural homeopathic preparation that will help, will bring relief, temporary relief to the symptoms of swimmer's ear infection. Right. So earlier we spoke about mild symptoms and very severe symptoms. So this would be applicable to mild symptoms, obviously, all right? Because if severe symptoms develop, then one should see a doctor, primarily because you don't want the infection to spread elsewhere besides the ear. And if you develop a severe infection, it means that your body is really struggling to take care of it in any case. So this is, what it does is that it in a way, homeopathic preparations seem to revive the body's abilities to deal with these symptoms. Okay, it's almost like an encouragement to them.
Yes,
go on and do this. And it can be used, as I say, for an extended period.
Okay, cool. Paulo, is there anybody who should be particularly cautious when using a product like this?
Most definitely. So anyone who has grommets or who has had ear surgery should not use it, should consult their doctor. If you are having dizziness and there is discharge coming out of the ear due to the infection, then you should not use the drops, consult a doctor.
Okay, and as you say, this is for mild symptoms, not advanced.
It's for mild symptoms, yes.
And Paulo, is this something that's available to anybody?
I believe so, in health shops and pharmacies.
Okay, wonderful. Thank you so much for sharing some insight on swimmer's ear. It's quite an interesting one. I think a lot of people might be dealing with it, but not quite aware. So thank you for that.